Welcome, Fearfully and Wonderfully Made Human. I'm your host, Diana Rice from Through the Valley Therapy and Transform Mind Consulting and Coaching. If you're new here, I say that phrase every episode as a reminder of your value because it comes straight from Psalm 139:14, which says, I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well. Whether you share my Christian faith or not, I say it because I believe every person is created with intention, worth, and dignity. And here on the Holistic Counselor podcast, we hold space for healing that integrates the mind, body, and soul, with room for both science and spirituality. Today's episode is one I couldn't wait to bring to you. I met Dr. LaNette Burgess at the United Way conference that I spoke at, where she led a session titled Anchored in Hope: The Role of Christianity in Healing the Mind. Her insight, presence, and heart for underserved communities, especially Black and Brown adolescent girls, was so impactful. I knew this conversation needed to be shared with you. Dr. Burgess is a licensed clinical social worker and PhD in psychological counseling. She brings over 25 years of experience in education and mental health, with a focus on helping high achieving women, teens, and families navigate trauma, burnout, and identity through a culturally sensitive and faith informed lens. So, whether you're here seeking clarity, encouragement, or practical tools for your healing journey, this episode will speak to you. I hope. Welcome, LaNette, to the show.
Thank you. Thank you.
All right. So, of course, I always like to start with the guest story. What led you to become a therapist, and how did your faith and cultural identity shape the work you do today?
Yeah. I think that there were a couple of things. I think my own kind of mental health struggles as a adolescent and a teenager certainly played a role in that. I definitely struggled with self-esteem, um, image issues, that led to some depression and anxiety. And so I think definitely struggling with that. Uh, kind of led me to that trajectory. But I think more than that was a friend's mom who struggled with mental health
Wow.
issues. And I was just so fascinated and kind of curious and like where the other kids would kind of make fun of her. And I knew that my friend was embarrassed and my friend treated her kind of mean, I would say. But I knew it was because she was like ashamed. Like her mom would just kind of like walk around the neighborhood and would be talking to herself and would kind of just stop in the middle of the street and be like looking up. And it just fascinated me so much. I had a lot of compassion for her, but I also wanted to know what she was thinking, like what is going on. And so from there, I just like psychology was just it for me. I came out of high school knowing that
Yeah.
at the time I thought I wanted to be a psychologist because that's all I knew. Like I didn't know about any of the other disciplines. But so yeah, I think it was her mom that kind of piqued
Yeah.
my curiosity.
That's it. It's curiosity. And you're right on. That's happened to me too, Lynette. Or Dr. Burgess. Dr.
That's
Burgess, Lynette.
Lynette is fine.
Well, it's just you worked hard for that. So to me, I want to respect it. But I get it. Like that's exactly, I remember too, middle school, just a lot of things. I could go back all the way to elementary school with stuff. But you're right. Like things were happening in my own family and, wondering why? It's the question why constantly. Like, why would someone say that? Or why would someone do that? Or why am I feeling this way? Or why am I highly sensitive and people telling me to stop being a crybaby? You know, it was right. And so that compassion that led you to go into the psychological route, like, you know, you started focusing more and more on Black adolescent girls in education,
Mhm.
right? What were the invisible struggles that you saw? Because I know you're from New York,
I
right?
am. So actually, when I got out of graduate school, my MSW, I went right into working in a school system in New York. It was kind of like a different school system. It wasn't New York City school system, but the school was designed to basically take students that New York City basically said they can't service anymore. That these students,
Alternative high schools, like alternative schools. Like,
like an
okay.
alternative school. These students, their behavior or their social and emotional or psychiatric issues were just too severe, right? And so we would take referrals and we would see if they would be a good fit. And at the time, I, I didn't have like any interest either way, like whether it was boys or girls, it didn't matter to me. But I definitely worked at a lot of different capacities in that school, and one of the things was doing intakes. So I would do the intakes for the school, and I started to just get curious about first, like all of the referrals were like 90% were Black or Brown students, right? And these are students that are coming from all over New York City, every neighborhood, every borough, and Long Island. So what's happening? Why are they all Black and Brown? And then for the girls' population was a lot lower. And we know that boys get referred to special education, or I think in Florida, it's called exceptional students, at a higher rate than girls. But what was so interesting to me was that the girls were seen as such a major problem. Some of those classes, the classes were like 12 students, one teacher, one assistant. And yet there were only probably some classes had two girls in them. Like the referral for girls were pretty low. They had two classes. Some had none, two girls. But the staff were always like, the girls, the girls, the girls. Even the principal like came to me one day and was like, you got to do something. And I was like, do what? And he's like, I don't know, but I'm tired of hearing people complain and they're saying, that the girls are a problem. And then it kind of tuned me into just listening. And yeah, the staff were like, the girls are disruptive, the girls are loud, the girls are provocative, the girls are all these things. And I'm saying, two girls in your class, like, how could they totally destroy your class? And so I started doing like little, so I don't know what to do. Okay, I'll do like a little girls group. And that kind of just grew over time. And with me listening to their stories and hearing the trauma and understanding why they're showing up the way they are and how these are trauma responses and not necessarily behavior and out of malice. These are survival. This is for their survival. It just God just put it on my heart that like, yeah, these girls they need somebody. They need someone to listen. They need someone to care. They need someone to understand. And so it just grew. It grew from small groups to just really specific programming for girls in that school. And I did that for over 20 years, like just
Wow.
and connecting with different organizations in the community to bring them in. And it just became a passion and on my heart. So when I relocated to Florida, wasn't sure exactly, how that would play out in the school system when I came in. But I happened to come across a documentary. Just, I say happenstance, but nothing is.
No, right. What was it called?
It was called Pushout,
Okay. What
and
was it
it's
about?
by Monique Smalls with the Culverson. I seen Smalls or Culverson,
Mhm.
but it was all about the disparities in education across the country for Black and Brown girls. And when I seen that documentary, it just was like, oh my gosh, this is like a thing. This is not like the school I was in, the school system I was in. This is an issue across all states and all schools. And so it just really resonated with me. And I was glad that I found that resource. And it just validated some of the stories that I heard and things that the girls were saying, because this is girls in other states and other parts of the country. Um,
So let's go there for a second because what was the disparity that you were seeing along state line, across state lines? What were the things that you're like, oh, the aha moments of that documentary or your research?
yeah, so one of the things that the research, just basically is blatant is that girls, Black and brown girls, are referred at much, much higher rates to being suspended, being expelled, to law enforcement. And they're for things that other girls are not getting referred to. Other girls are getting phone calls, other girls are getting detention, other girls are getting, spoken to. But Black and brown girls, the treatment is so much harsher and so much more severe, which creates this push out, right? So the more that you are expelling girls, the more that you're suspending them, the more that you are any contact with law enforcement is never a good thing. And
Right.
it shouldn't be done when it's for a dress code violation or it's because of their a bad attitude. Like that's not a reason to refer somebody to a SRO, right?
Yeah.
And so the more that, I started to notice that, oh yeah, these girls are, um, they're getting this harsh treatment, but I couldn't understand why. And then I came across another study, and this study was done by Georgetown University. And this study spoke to a phenomenon called adultification. And I don't know if you're familiar with that.
I kind of, yeah, let's tell our audience though.
Yeah, so adultification is a phenomenon that specifically is seen with dealing with Black girls. And that's where adults view the girls as being older than what they are, right? And so you're looking at an 8-year-old, but you're not seeing an 8-year-old. You're looking at a 12-year-old, you're not seeing a 12-year-old. You're looking at a 15-year-old, and you're not seeing a 15-year-old. And the problem and the danger with that is if you remove who they really are and the age that they really are, then you're removing the nurturing that you would give to that student. You're removing the care, the compassion, you're removing the safety because you're looking at an 8-year-old and you think she's older. And so you're not addressing her and engaging her as an 8-year-old little girl, right? So she's not allowed to make the mistakes that an 8-year-old would make because you don't see her as an 8-year-old. And this study just revealed that this happens time and time again. And Black girls and brown girls say that they're often told, you should know better, or you shouldn't be acting like that. Um, they're often told things like, you're being too loud, you're being too aggressive, you're um, just the way they present is seen as always a behavior, always a problem. And
And then wait, and then you have that, and then you put on top the unhealed humans raising them, right? And in that situation where it's like they don't have the mindset or the tool set to have good communication skills or, so then it becomes like, what's wrong with you? I mean, I've seen it time and time again within my community and at the school system because I've worked,
absolutely.
right? It's
Yeah.
like, and it's just like so much hypervigilance and these young girls sometimes are passing puberty at like 9 they have women bodies like
Mhm.
that's another thing.
Well, that's actually another thing that came out in my research is that so a lot of times Black and brown girls are referred to disciplinary actions because of dress codes, right? But here's the thing. When we are doing a dress code violation, I'm all for you need to come to school appropriate.
Mhm.
But we have to be sure that if I am saying to Samantha that what she has on is inappropriate, then I got to be saying to Diana it's inappropriate. And what happens is that with Black and brown girls, because they could tend to be shaped differently, they're fuller, they have fuller figures, that it's not actually the clothes that
Right.
you are deeming as inappropriate, it's the body. And
Mm.
so if you and I come to school dressed the same, we're being twinsies, and I'm the one who's getting sent and you need to go change and you got to go put on something, and I'm looking at Diana, my friend, and we have on the exact same thing because we bought it together, then what in fact I'm hearing is that my body is inappropriate.
Oof.
That's not okay. That's not
Yeah. And I saw that so many times, Lynette. And I mean, I think that's why I have people say I have some kind of masculine energy because I was always this tiny little thing. I'm still trying to pass puberty, honestly. Because I would, and I am grateful because what I did see is these other girls being, and I'm going, oh, it was confusing as a little girl looking at that, going, and then it did something like, oh, okay, well, I have no boobs, no butt. It's like, all right, but a girl that does, this is how they get treated.
Mhm.
And I would get really like uncomfortable and angry about that. And I'm like, wait, that's no fair. And I remember how many times I had to say, that's not fair in my
Right.
head. I couldn't
Right.
say it out loud because I didn't want to get reprimanded or beat down or whatever it is. But I'm sitting there going, wait, what? And so in your research, like, I mean, this makes sense with what I'm now. I mean, like you're putting it in words where I'm like, oh yeah, you're giving me aha moments in the midst of our conversation. Like, wow, I did not know that. So what else with your research? What was the name of your dissertation?
So my dissertation
What
was
was on?
creating safe spaces for Black girls in education.
Oh, wow. Okay. Wow.
And so what I did was I developed a curriculum, basically like a webinar or a workshop for staff, for students, not for students, for staff, for teachers, for mental health staff, for admin, anybody in the school system, to just kind of educate them on working with Black girls,
Yeah.
some of the trauma responses that we see, right? Because I think we do a good job of helping staff understand and look for, things that are like for depression, right? If a student comes in classroom and they're disengaged or their head is down or they look disheveled, you should say something, you should alert somebody. But there are so many nuances that we are not educating staff on, right? And so not all students show up the same way if they're depressed.
No.
And one of the things that I found in my research with Black and brown girls is that a lot of times irritability shows up, and that's a key factor of depression.
Yeah.
But it's viewed as disruptive, it's viewed as just a bad attitude, it's viewed as just trying, it's almost like intentionally they're trying to be disrespectful.
Right.
And
Yeah.
what I notice is that a lot of times, happens more with men, but sometimes it happens with women, is that when the students up here,
Mhm.
the staff go here because the
Oh,
staff
yeah.
are not even able to regulate their own emotions and stuff,
Exactly. And
right?
they're protecting themselves
Right, they match
and
that
yeah,
energy, and that is
it's
like exactly
no, I saw it. I worked at the alternative high schools. That's what they would bring me. I was a crisis intervention counselor, and they would be like, "Let's de-escalate, Miss Rice. Well, what we need to de-escalate." And
right.
it's like teaching the staff how not to take it personal.
Mhm.
Okay, how to recognize your own stuff,
Right.
and I get it because if you feel like you're being pushed into a corner
Absolutely.
and you have a high adverse childhood experience score, right? And you're hyper vigilant already going into the school
Mhm.
and you're not feeling safe. And let alone not only that, but then the way schools are, that bright light, the walls coming in on you, not enough nature and breath and healthy foods. So you're like on. You are hyper vigilant. You're on. Your brain's on fire, and all it's trying to do is survive and protect itself.
Mhm. Yeah.
Okay. And
Yeah.
so tell me about what your curriculum is about. I'm curious. Like, are you still using it? How can I help you get it out there more? Because
Well,
honestly, we need,
with what we're dealing with now, it's a little challenging, to be honest. It's challenging. I was able to present a couple of times already, which I was so grateful for, and the feedback was phenomenal. So I'm really happy and excited about that. Yeah, it definitely it's geared towards schools, but actually with my chair. Um, when I was doing my doctoral program, they were like, you can tweak this for churches. You can tweak this for so many other different, even mental health staff who they're not aware that when a student is referred to them for a behavior issue, right? A girl, that irritability, you better be looking at depression. Like, don't look for sad and down and not hanging out. You look
right,
for that prickly,
right.
everything bothers them, everything is a problem,
Yeah.
everything, because that's depression. That's the
Yeah.
problem with depression.
Do you, because I know what one tool that I loved and that was free because that's another thing. If we're working with some of these populations, they do not have the money and resources to send them to a nice $250 place to get the therapy or horse therapy or equine. I mean, stuff like that. Like, it is what it is. And I'm not putting that down either because, we're all here to try to help the
Right.
human being, no matter where you're coming from and no matter what color God made you. So, So for that, the anger iceberg from, and if not, I'm going to put that in the show notes, people, so that you'll have at least one tool
Yeah.
to print out. But it's called the anger iceberg, and that tool to me
Is
when
that the one where you see underneath, like your
yes,
little,
and I would just have them highlight, or I would read to them because some of them couldn't read, and that's another frustration that I saw, Lynette, like in the middle school when I used to work in for Friends of Children, and they would put me into all the North Broward County schools as a therapist. I had clients in every one of those schools. I realized I'll never forget when this 13-year-old boy was like, "I rather be known as a gang member than because he couldn't read
Mhm.
than stupid." That shifted my entire perspective to a place where I was like, oh my gosh, I
Mhm.
learned so much with these students. Like this is why I love these teenagers so much. No matter what, they've thrown stuff at me. They call me F and B. I mean, they call me all these names, but I think it was the Lord, honestly, that protected me and put me in those spaces and places. So now here we are
Right.
with the understanding, and I can actually speak about it and with love to teach others. Because how many times have I heard, well, they just got a chip on their shoulder? I'm
Right.
like, yeah, well, if you understood what's happening in their science wise, in their brain and body, if their foods are not healthy foods because they can't afford the health. I mean, I could go into a rabbit hole with you right now.
Yeah. And here's the thing, right? I don't think for the most part, staff go into education with the intent of triggering and re-traumatizing, right? They're not doing that,
No.
but it's happening, and so we have to be aware of how can we push uh, our relationships with these students forward because we know that the number one factor in a child's success is connectedness to the school.
Yes, I said that before we went on.
Yeah,
Remember? I
it's
said it was, even though Broward County schools, some people have a lot of bad things to say. I have to say my experience was where I felt the safest.
right, exactly. So imagine with everything that was going on with you in your home, and then coming and having to spend 7 hours in a place that you didn't feel safe and didn't feel connected,
Oh
right?
no, you're gonna get me to cry now.
Yeah, and that's what we want. We want our students to come in and feel safe and feel connected and feel loved on, right? Because when they walk out of those doors, we have no idea what's going on,
If
right?
they're being fed, I mean, and not fed just with food, fed,
Oops. Right.
right? With love, with spirit, with protection. And it's something, oh my gosh. Whoa, sorry guys.
No,
Um,
absolutely.
yeah, like I'm glad my empathy's not totally gone.
No, because you lived it and then you came back and you were there and you saw it again. But for a lot of students, and again, I'll just talk about the girls, like they're coming into a building and not only do they not feel connected, but sometimes physically they're not safe. Their bodies are not safe.
Right.
Right? How many
Yeah.
girls are getting groped walking through the hallways and that's pushed
Oh,
under the carpet? That's like not me. That's not a big deal.
boys will be boys.
Boys will be boys and even some of the girls like in their home they're kind of told like just change your
Yeah.
route to the class or
Yeah.
just try and get through or just push through, right?
Right.
That's what girls are taught.
So, especially us black and brown girls are
Mhm.
taught not only at home, hey, toughen up, push through. This is life. This is how it is.
Right. We don't have the luxury to, be wallowing and talking about all this feeling stuff. It's like, no, like you got a job to do. You got to finish school. You got to, get an education. And it's this push, push, push. And it's not terrible, but it has to be kind of counteracted
Balanced.
with love and compassion and listening. As adults, we do such a bad job of listening because we want to immediately, show them something different or give them a different perspective or tell them why what they're feeling is not, that's not right. And she didn't mean that. And well, this is what they're trying to do. And just, or we direct the conversation back to the academics, right? A student comes to you about a breakup. In some way in that conversation, you're talking to them now about their math grade. Why?
Well, the thing is, too, though, that's one thing I realized being in the school system. Guidance counselors that I've met and spoken with, many, or social workers too, because I'm MHC, right? So the reason I was able to work in the school system was because all my internship and everything was in a school. Like they placed me in a school, so I was able to like have the dual thing.
Mhm.
But what I realize is they go in to want to do the counseling like we do in private practice. They
Mhm.
want to be there with the student. And then they realize, no, it's more about the red tape and the, okay, 5 seconds or the 10 minutes you got. Elementary school, I hear, is a little different because but what middle and then high school, forget it, because you have one counselor for how many students?
Yeah.
And they're not able to do and they get burnt out because it's more about their grades, passing, scheduling, and so that's a frustrating part. I think things had shifted after the Parkland shooting in Florida. I don't know if the whole country, but I can only speak to my county. When did you come to the Broward County school system?
I started in, I started the week we shut down. I started that Monday and schools closed Friday. So that was what, 2020? That was March of 2020.
Wow.
Yep, I started Monday. And Friday I got a email saying, don't come Monday. We're not sure what we're doing. And yeah,
Yeah, and that's the thing. I don't think anybody was sure what that was what anybody was doing. I think we
nobody
were
knew.
all
The
we were
whole
all guinea pigs
the
in
world
in the
didn't know.
whole,
And that's
yeah.
the other thing. These students are coming out of a pandemic where they didn't go to school for a year and a
And
half.
got addicted to the
Right.
devices. All right. I mean, not that they weren't addicted before, but that situation and trying to find truth and going into the social. I mean, there's so much, but
So much.
we could sit here and talk about all the issues and problems, but I think we're going to shift the conversation now to go into the hope, the tools, because if a teacher's listening or a guidance counselor or a parent or even a student,
Mhm.
right? Like what is it that you like how do you start with that? Like if you're going into a group or with your curriculum, what's the first thing to get people to understand and give them that hope?
So the first thing is always just awareness, right? And being open to accepting things about yourself, right? So when we're talking about biases and how we look, th there's nothing, a bias is something that your brain does kind of automatically. So when we're teaching people about being aware of your biases, sometimes they take it very, like, they get
Yeah.
defensive. Like,
Yeah.
no, that, like, I don't do that. Our brain does it automatically. And if you keep denying that your brain is putting students in certain categories as soon as you see them, then you're not going to be aware enough to kind of work through that. So the first thing is awareness, right? And
Hmm.
it happens to all of us. If I had a bad experience with a particular student, and then another student comes in front of me who kind of my brain says that's the same student, I'm going to probably engage with that student in the same way. So just being aware that our brain does that automatically. And the more
Hmm.
that we're aware of, the more that we can kind of counteract that and see everybody as an individual. Right.
Right.
Um, Trying to slow down when you can. And like you said, everything is very fast paced and it's about this, this, and this. When you can, slow down, and try and build those connections.
How? Let's give them a couple of tools because I know you know how to teach that. Like, how do we get our clients to slow down or our students that we work for? I mean, to me, like I work for them in a way because it's first of all, they're hiring me to do something, right? And so what are one or two things that you actually help your teenage girls to slow down with?
Yeah, so I actually we started doing some groups in the high school that I'm based out of. And it was a great experience. This was actually the first year that we started doing them. And the first thing that we do is that we invite them in, right, to see if they're interested in being part of this kind of, we didn't really even name it. We said like a girls group, but like, what do you want it to be kind of thing. And so to me, that was very important for them to take ownership, to tell me. Like I know what kind of topics I want to do, but what
Mhm.
do you think you need help with?
Yeah.
What do you think? What are you struggling with? And so that's how we started. We started with, hey, let's come up with a bunch of things that you guys want us, as myself and another social worker. What do you want us to kind of help you with? What do you need support in? What do you need guidance in? And they gave us a couple of things. And then we said, oh, well, would you like to learn about problem solving? Would you like to learn about managing stress? Oh, yeah, yeah, yeah. We're really stressed out, and people don't realize how they think that, because we're teenagers, we don't have stress, and these kids are stressed.
Yes.
And
And very intelligent. Like
and
they
very
pick, that's
intelligent,
what, yeah.
very self-aware.
Yeah.
Teenagers are, that's why I love working with them.
Yeah.
They're so aware.
Hmm.
And so I think that's one of the first things that I would say is to collaborate. Get them to kind of join in on
Yeah.
what you're trying to do as opposed to us just implementing something.
Right.
Okay, we need to do this, or we're going to do this. And we don't get their feedback and we don't get their input. And so they don't get connected to it because it's something that we came up with. So
Yeah.
collaboration, I think, is very, really, really important.
What I'm hearing as you're speaking and talking about what you do, it's to me, it's respect.
Mm.
You, because that's what's missing a lot with teenagers. They don't feel respected. And of course, and then now they're like getting big, they become stronger than the older people, right? And they're just like, you know what? I'm tired. Like I go from trusting the adults to realizing these adults are like they're a mess themselves and they're telling us what to do. I mean, these, and so it's like a respect. So the collaboration I hear is like you're teaching them to be respectful to themselves and to each other, and
Yep,
that they are worth something, that they count.
exactly. You count, you matter. I
Yeah.
see, right? Um, Another thing I would say, especially with Black and brown girls, is it's okay to ask for help because Black women, Black girls, they're not raised, they're not socialized to
Mhm.
ask for help. They're
No.
raised to help. Especially if you're a Christian, you're raised, right, to be the hands and the feet of Jesus. You're raised to do all the things and jump in and be all the things, and you don't ask for help because you are helping. You're
Mhm.
helping. So teaching the girls that you can ask for help. You're allowed to ask for help. You don't have to figure this out on your own. And even if it's something that other people think is not important, it's silly, right? A relationship, a friendship. I think it's important. I think
Yeah.
you breaking up with a friendship or you having a fight with a friend, because that's
It hurts.
right. And it's going to impact your functioning
Right.
and your education, right? So we're really concerned about education. So we got to address the things that matter to them, and that kind of creates barriers for them, right?
Yeah. Yeah. No, I remember where some student, I'll never. Okay, this student, I'm not going to name boy or girl, but he was. Oh, now I just said it. But he was a young black man, but he was known in the streets as one of the biggest gang members and drug dealer, right? And so the thing is, like, I gave him a safe space, and he would come in sometimes in my office and would sometimes pass out. And he was in juvie, in and out in juvie since
Hmm.
third grade, and we haven't even touched that pipeline yet. But yeah. But anyway, long story short, it's I gave him respect enough, and because I didn't go in there with his thick folder of stuff, because that's another thing that happens in our systems is that the folders passed on, they already have a belief, whoever gets the folder, and it's understand like no, to me it was my Christian faith that's like no, you're everything's wiped clean right now with me. Right, and I want to know you, what would like what led, so the respect and the understanding, and and also you got to check your own fear as an adult working with young people.
That, you know what, that came up a lot with girls, and even in the documentary, that they kind of laughed and they were like, "Oh yeah, some of the teachers are afraid of us," and they would laugh because it was weird to them. Like, why are you scared of me? And
Yeah.
so, when you operate out of fear, right, it's
Exactly.
not going to be a good connection or relationship.
Right. No. And so that fear, I think we need to talk about that, that false evidence appearing real,
Hmm.
right? I know I could tell that you're teaching girls and everybody around you that it's like you got to face everything and rise. I don't know who taught me that a long, long time ago, but I say it all the time. So it's not my quote, people. I'm not taking
It's a
ownership, but I
good
use
one.
it. Yeah, face you either it's either false evidence appearing real and that's how you act, or you face everything and rise. And to me, like you were just talking about like the pressure on black and brown girls and how we're taught to be helpers and not ask for help.
Hmm.
I was like, ooh, and it's right because it is taught in many of our cultures that asking for help is a form of weakness. And we can't be weak because the world's gonna get us and the white man's gonna bring us down. And I remember all that too. And and I have to say now that I said that, like, no, I don't think that way because I did the work. I educated myself and understand that human beings, no matter where they're coming from, I try to look at the intention of the heart.
Hmm.
Okay, so saying that because sometimes my white friends or my husband who's white will be like, honey, why it's bad enough. People think that I'm like, and I'm like, no, because they are not, let them get to know you. But anyway, because I want to break stigma in all avenues. So with fear and all that you were just saying, and in the churches,
Hmm.
sometimes what happens, we become Martha.
Hmm.
Okay. And many people don't. I had to do, and I still do work with therapy because I have that type A Martha. Some,
Ah,
somebody was talking about that didn't know me. They're like, you have a lot of masculine energy. And I'm like, ooh, I know where that's coming from. But it isn't, it is, it is a lot to how we were raised. Like, toughen up. You got to be tough in this world. Like, don't let nobody
right,
mess with you.
right.
And
Yeah.
so I've had to learn to balance that. And I know you know what I'm talking about.
Yeah, definitely. With and that whole like kind of like Martha syndrome, it's like always doing, always needing to be busy, always needing to, it's like the striving of, more degrees and or you're in all the ministries and you're just doing all the things. And unfortunately, that leads to burnout, that leads to exhaustion, not only physically, mentally, spiritually. You can end up so broken because I've been pouring and pouring and pouring. And no one's ever taught you that you can only give out of your overflow. You can't,
Mm,
if your cup is not there, then that's a time for you to pull back. That's a time for you to say, wait a minute, right? I need to be still. And I think that we undervalue stillness and we undervalue solitude, because you need to be out there, you need to be doing, you need to be busyness is like connected to some kind of value and worth. If you're booked and busy, you're somehow more valuable than someone who's not. And productivity, right? If you
yeah.
are productive, that means that you're constantly moving, right? That's what
Yeah.
we're taught, that if you're sitting still, you're chillaxing, you're not being productive.
You're lazy.
Right. But rest is biblical. Rest
Mm,
is, if you want to go that route, or if you just want to go strictly clinical, rest is one of the most important things I talk to my clients about. Because if your sleeping is not where it needs to be, your everything else is off.
yep.
Everything else is going to be um, impacted by poor sleep.
Right. And now that you're saying sleep, this is what comes to me with the rest and the sleep. I've learned as well from my clients that sometimes they are in Martha mode or overproductivity, not only because they're taught that, because in the stillness, all the feelings and emotion and past traumas start coming up and they're trying to push it down and push it down. So guess what? How am I going to push it down? I'm going to work, work, work. If not, I'm going to drink, drink, drink. If not, I'm going to do this, this, this. And honestly, we have to get to that place to let it come out
Mhm.
and heal it, get it out of the sub. And that's why sleep is important because guess what? It's still. And if you're not having good sleep, that must be your body trying to tell you something and you must listen to it.
Right. Right. It's like I heard a doctor and she specializes in sleep and she said that um how we get it wrong. Like we work I'll sleep around our day, right? How many hours we get depends on what we have to do and how much we have to get done. And it has to be the opposite. We have to set our sleep and how much you need, how much you require, and then everything else goes around that. So I require more sleep than most people. I require 8 to 9. And most people think that's a lot, 9 hours. But I have to get everything. That's why I remember I told you at that United Way conference, I didn't sleep and I was not good.
Well, man, I need to go to another one of your workshops when you are because I was
I
impressed.
was
That's
no,
why you're here, girl.
I still have I still have bad feelings about it because I know that I didn't show up the way that I wanted to. And so that's my own work having to release that because things don't always go as planned.
No, exactly. And honestly, I think that's a lesson for the Martha part of you
Mhm.
because you did show up. And we have to remember because we are women of faith, we're only vessels and the Lord used you. Okay. Because I didn't know you. LaNette,
Right.
I did not know who you are. I just met you.
Fine.
I went up to you after you were done. I would have never known. I would have never known. And you know what I love is that you just share that vulnerability. So for whoever is listening and understand, this is a strong woman who had a strong presentation and she just was vulnerable. And that's something to be taught as well,
Mhm.
especially in our Black and Brown community,
Yeah.
right?
Yeah.
So before we end our episode together, I don't want it to end. And I know we probably could talk about a thousand other things. I just want to give you time to talk to the audience and whatever is coming up in your heart, if it's Bible verses, it's encouragement, just how, what, where, I don't know, whatever is coming up for you. Like, what would you say to a woman listening right now who feels invisible,
Mm.
overwhelmed, or like she's doing everything right, but still feels really lost?
Yeah. Yeah, I think that's misleading, that idea that I'm going to do everything right, that perfectionism, and that somehow is going to be connected to peace or joy. You can do everything right, you can check all the boxes and not experience joy, not experience peace, not experience clarity, right? So that's one thing that we have to get to the root of perfectionism, get to the root of people pleasing, right? And that might mean going back and doing some psychoanalytic work to where that started and how that developed, right? Because those things develop. Those things are either you learn or you're taught that or you adapt that because of a response to your environment. And so I learned that I need to perfectionism is a way to keep me safe, or people pleasing, right? Fawn, always saying yes and being agreeable. I'm able to keep safe and I keep the smoke off of me and the heat. And so now I'm 40 and I'm still doing that. And it's
Yeah.
not serving me, right? And so now I'm finding myself feeling like, what is this all about? I mean, um, when I hear someone saying that they're lost, or when I've experienced feeling like unseen or lost, I love going to the story of Hagar in Genesis because she ran off, she escaped. I believe it was Sarah who was treating her really poorly and mean. And she ran like into the wilderness. And then God spoke to her, and she actually refers to God as the God who sees me. Right?
Mm,
She, I believe it's pronounced El Rohi, she calls him, the God who sees me. And it was so profound the first time I came across that. And it was so like divinely driven for me to see it, right? At a time where I was feeling unseen. And the thing that sticks out to me with that story is that not only did God tell her that he sees her, but he sent her back. So he didn't remove her from the situation. So sometimes when we're in these seasons of our lives, we just want to be out of it.
yeah.
We have to remember that there's purpose in them all. The wilderness seasons we all hate, right?
Yes.
But there's
Yes.
purpose in them.
Yeah.
Pruning season we hate. We feel like things are being pulled away from us. Growth seasons, even a growth season where you're being stretched to do certain things or show up in certain ways that feel like, oh, so uncomfortable. I think just anchoring in it and knowing that this season is not for nothing. This is a season that God has you in for a purpose, for something to come, right? He's
Yeah.
either stretching you or he's pulling things away from you or he has you separated in this wilderness by yourself. And that's a time to anchor and do this, right? Go this
Yeah.
way and
Yeah.
not look this way.
That's it.
Time that we have to go this way because that's just me and God in the seat,
Yeah.
right? So yeah, I would just say just know that God does see you. Keep anchoring, keep hope,
Yeah.
right?
It's being in the word, right? And to me, it's really important to understand who you are,
Mhm.
especially in Christ. Like even if you're not a Christian, like learn because what happens is many people see Christianity through the lens of the person claiming the name.
Right.
And what I tell my clients who come that are curious or learning to disentangle their faith because of a lot of religious trauma
Mhm.
is to understand. That's why I always start with Psalm 139, which I quoted in the beginning, right? It's
Favorite.
yes, all the way to the end, because at the very end of Psalm 139, it says, Search my heart, O God, and know my anxious thoughts.
Yep.
Okay. And in being still, and when those things come up, people, this is where you write it out, journal it out, find a therapist that understands. I mean, so let's talk about that, LaNette. Are you seeing clients now?
I do. I do see clients. I have a small practice. I see clients only virtually here in Florida, in
Okay.
Texas, New York, and
Oh,
New Hampshire.
oh my God. Okay, wait, we need to name all those licenses because if there's a listener who's like, I want to work with LaNette. All right. So
Yeah,
you said Florida,
yeah. New Hampshire,
New
New
Hampshire.
York, and Texas.
Okay.
And I see clients virtually,
Okay.
um, and I do accept what's an
Ins-
amazing insurance. Um,
I love that. So
and
she accepts insurance. Can they find this on your website?
Yeah,
Oh,
Embrace Therapy and Faith is the name of my company. I'm on Psychology Today. You can find me through Alma, and I
okay.
work with girls from the ages of 13 and older.
Good to know.
Yeah, if they can navigate a virtual sessions for even some adults, virtual is not doesn't.
No.
So if you
Right.
if you are able to do virtual and you think that it works for you, and it doesn't necessarily have to be Christian. I have, clients who
Hmm.
are not Christian, and we still talk about identity, and we still
Yeah.
talk about separating what you do from who you are. And
Oh, I love that.
you entangle what you do with who you are,
Hmm.
yeah, that becomes a problem. That becomes
Yeah.
an issue, right? So
Well,
a lot of things we can work through and doesn't necessarily, I mean, my worldview is a Christian worldview. I never,
yeah, mine too.
never, I never, but it's not imposed,
No.
and unless you,
It's if they want it. Like I know with me, people come and I'm like, do you want a faith component or not? If not,
right,
if you want the science part of my brain, I'll do that. Like I know that's our training. It's like I'm not coming in as a person that's going to, that's the thing. That when they're disentangling, that says like, well, I was told I'm going to hell. And I'm like, well, where did you find that? Because to me, it's about asking questions, not telling them what to do.
yeah, and even when you're not, right, even when you're doing just a clinical and secular, those are questions that you're gonna ask. Who told you that? Where did
Yeah.
you learn that, right? When they tell you things that just are not in alignment and maybe untrue, you want them to kind of figure out, where'd you learn that? Or who
Yeah.
told where'd you
Right.
get that from, right? Because it's
Yeah.
all about reflecting and recognizing like certain patterns and attachments and where these things come from so that you can show up different
Yeah.
and better.
That's it. Yeah. And learn how to reframe. I mean, this is the tools that we have spent years and years and years and years sharpening in
Yeah.
order to help the human that comes to us. So, well, Lynette, thank you so much for coming
Thank you for
here.
having me.
I love this conversation with you. It's because I feel like we're sisters.
We definitely
Oh,
are.
wait, from the same mister. Yes, I'm corny. I'm very corny.
They are, and I'm just so honored that God allowed us to connect. And I definitely feel like it was an answered prayer because I was looking for community, and you introduced me to a community that I love.
Yeah, good, good. I can't wait to like hang out in person. So anytime there's something, I always send it to the group. And she's talking about the Christian mental health professionals that we
Yeah.
have here in in South Florida. And I think actually we have people from Georgia and everything. It's just a growing community, which I love a lot. I've learned a lot from them. Anyway, LaNette, you have a great day. And for my listeners, please, please, please remember to trust in the Lord, guard your heart, and renew your mind. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.